The second edition of the Guidebook to Molar Endodontics, edited by Ove A. Peters and published in 2025 by Springer Nature, Switzerland, belongs to the field of endodontology, more specifically to the diagnosis and treatment of molar teeth, and is intended for both less experienced and seasoned clinicians. Its aim is not to serve as yet another general textbook of endodontics, but rather as a guide to clinical decision-making and treatment procedures in an anatomically and technically demanding group of teeth, with particular emphasis on risk assessment, clinical judgment, and the execution of treatment plans. The subject is highly relevant because molars combine diagnostic, anatomical, infectious, and restorative complexity. The book comprises 12 chapters covering root canal anatomy, diagnosis, imaging, local anesthesia, vital pulp therapy, access cavity preparation, shaping, disinfection and obturation, restoration, cracked molars, treatment outcomes, nonsurgical root canal retreatment, and endodontic microsurgery. The sequence broadly follows the clinical workflow, while the extensive visual material effectively links anatomical considerations with clinical procedures. Each chapter includes a guiding reference as well as a broader bibliography, although the level of evidence varies considerably, ranging from systematic reviews, meta-analyses, randomized controlled trials, and clinical guidelines to pilot studies, observational studies, epidemiological data, and expert experience. The chapter dealing with treatment outcomes relies particularly heavily on contemporary systematic reviews. Independent verification confirms the methodological rigor of the 2023 Clinical Practice Guideline of the European Society of Endodontology and the existence of its 2025 position statement on longitudinal cracks and fractures. For this reason, the second edition remains highly current in 2026 overall, although recommendations concerning specific materials, medications, and devices should still be checked against the most recent clinical guidelines. The first key message is that anatomy must guide treatment. The chapter on anatomy links root canal complexity directly with access, disinfection, and obturation, paying particular attention to additional canals, isthmuses, apical ramifications, and areas of reduced dentine thickness. The author also appropriately cautions that estimates of the prevalence of anatomical variations depend on the study methodology and the population examined, which reflects a scientifically responsible approach. A second important practical recommendation concerns access cavity preparation. The authors support the preservation of sound dentine but reject the assumption that an extremely small access cavity automatically represents better endodontic treatment. They cite experimental evidence showing a greater proportion of uninstrumented canal walls, less effective cleaning, and greater difficulty in locating additional canals with highly contracted access designs, while also noting the absence of clinical studies demonstrating equal or superior success rates for extremely minimally invasive approaches. The practical message is clear. Dentine should be preserved as far as reasonably possible, but not at the expense of adequate visualization of the pulp chamber floor, identification of all root canal orifices, and effective disinfection. A third major area is vital pulp therapy. This chapter draws on a randomized controlled trial of deep carious lesions in which stepwise caries removal reduced the incidence of pulp exposure compared with complete excavation, while long-term follow-up demonstrated that the prognosis is not universally favorable. The book discusses selective caries removal, direct pulp capping, partial pulpotomy, and full pulpotomy, with strict attention to asepsis and the use of contemporary calcium silicate-based materials. This is not presented as a universal treatment formula. Case selection depends on symptoms, lesion depth, pulpal status, hemostasis, the ability to achieve adequate isolation, and the quality of the definitive restoration. A 2025 systematic review supports several forms of vital pulp therapy in carefully selected permanent teeth, but this does not eliminate the need for appropriate case selection. The chapter on shaping, disinfection, and obturation probably offers the greatest immediate value for everyday clinical practice. The emphasis is placed on asepsis, reliable working length determination, shaping that enables effective irrigation, the use of sodium hypochlorite as the principal irrigant, and removal of the smear layer with ethylene diamine tetraacetic acid. The book refers to the clinical practice guideline of the European Society of Endodontology and acknowledges the possibility of single-visit treatment in appropriately selected asymptomatic teeth with mature apices when adequate clinical procedures have been performed. Importantly, the authors do not suggest that any single instrument, device, or obturation technique guarantees success. Greater importance is given to infection control and the prevention of procedural complications such as perforation, canal transportation, and overfilling. Particularly valuable is the warning regarding sensory disturbance following extrusion of root filling material in the region of the mandibular canal, as well as the need for appropriate documentation and referral of the patient for further management when necessary. Another major strength of the book is that it does not consider endodontic treatment complete without an adequate definitive restoration. The restorative chapter critically examines the traditional assumption that every root canal-treated molar necessarily requires a full coverage crown. Instead, the authors consider the amount of remaining tooth structure, the need for cuspal coverage, indirect adhesive restorations, endocrowns, and the possibility of future retreatment. The systematic review and meta-analysis cited by the authors report favorable outcomes for indirect adhesive restorations, although the book appropriately points out that some of the available data do not distinguish molars from premolars. Particularly useful is the concept that restorative planning should take future endodontic re-intervention into account. Posts do not improve tooth survival, while their removal may substantially complicate retreatment. The four greatest strengths of the book are its clinical integration of anatomy, diagnosis, treatment technique, and restoration, its willingness to distinguish robust clinical evidence from laboratory-based assumptions, the high-quality visual material that facilitates the understanding of complex anatomy and procedural steps, and its long-term, patient-centered approach to treatment outcomes, including pain, function, tooth retention, peri-apical status, and the possible need for future interventions. The most important weakness is the uneven level of evidence supporting different sections. For example, the guiding reference in the chapter on local anesthesia is a pilot study from 1985, whereas other chapters are built around recent systematic reviews and clinical practice guidelines. This does not mean that the content of the anesthesia chapter is incorrect, but it does demonstrate that a guiding reference should not automatically be interpreted as representing the highest level of evidence. Second, the chapters on retreatment and microsurgery inevitably contain a greater proportion of operator-dependent procedures and expert experience. Third, magnetic resonance imaging is presented as a promising future technology, but it is not yet a routine standard of endodontic care, and its potential should not be equated with established everyday clinical benefit. Fourth, the chapter on treatment outcomes proposes a new composite approach to evaluating success, but the author himself acknowledges that it requires statistical assessment and testing for reliability and validity. It should therefore not be presented as an established clinical standard. For dental students, the book is excellent supplementary reading, although it is too detailed to function as the sole introductory textbook in endodontics. It will probably provide the greatest benefit to early career dentists, general dental practitioners who regularly perform molar endodontics, and postgraduate trainees in endodontology. For specialists and university faculty members, it is valuable as a reference source and teaching framework, but it does not replace continued engagement with primary research and updated clinical guidelines. 3 professional principles are particularly worth taking away from the book. First, successful treatment begins with accurate diagnosis and a thorough understanding of anatomy, not with the choice of instrument. Second, preservation of tooth structure is beneficial only as long as it does not compromise the identification and disinfection of the root canal system. Third, long-term prognosis depends on biological control of infection, technically sound treatment, and a high-quality restoration planned with long-term tooth preservation in mind. Does the book deserve a place in a dentist's professional library? Yes, particularly for clinicians who regularly perform endodontic treatment of molars. I would primarily recommend it to general dental practitioners with a substantial endodontic workload, early career dentists who have already acquired basic endodontic training, and postgraduate trainees in endodontology. Clinicians who rarely perform molar endodontics, or specialists who routinely follow the most recent primary research and clinical guidelines, may use it more selectively. Its greatest strength is the way it connects clinical decision-making with anatomy, scientific evidence, procedural risk, and long-term tooth preservation. Its principal weakness is the variable strength of the scientific evidence across different topics. It is best regarded as a clinical guide and reference manual with substantial textbook value rather than as a formal clinical guideline. Is it worth the time required to read it? Yes, provided that it is read critically. Its real value is not in telling the clinician which instrument to buy, but in helping the reader assess cases more accurately, avoid irreversible procedural errors, and plan the treatment of a molar as a tooth that should remain functional for many years.